According to the Agency for Healthcare Research, low deductibles and small copays can increase the cost of our health insurance by as much as 40%. That's because minimal copayments enable and encourage us to submit insurance claims for minor healthcare expenses that we can afford to pay without insurance. Of course, we all need insurance to cover major healthcare expenses, like surgery or hospitalization, cancer or diabetes, stroke or heart attack. But expecting our health insurance to pay for minor medical expenses, like routine checkups, antibiotics and immunizations, teeth cleaning and vision exams, is like expecting our auto insurance to pay for routine maintenance, like oil changes, tune-ups, tires and brakes, or expecting our homeowner's insurance to pay for household repairs, like plumbing, electrical, roofing, and painting. We certainly need to pay for those expenses, but we don't need insurance to pay for them. That's one reason why auto and home coverage is so much cheaper than health insurance. So how can we save as much as 40% on our health insurance? By paying for minor healthcare expenses with a tax-exempt health savings account and a low-cost major medical plan. It's a combination that can not only reduce the cost of your insurance, but it can also minimize your future rate increases, allow you to pay for healthcare services not covered by your insurance, and pay for all your healthcare expenses with tax-deductible dollars. A health savings account, or HSA, is like a 401k account, but for healthcare expenses instead of retirement income. The money you deposit into a health savings account is tax-deductible, and the interest you earn is tax-exempt. But unlike a 401k account, the money taken out of an HSA to pay for healthcare is also tax-exempt. You can deposit more than $3,000 a year into a personal HSA or more than $6,000 a year into a family HSA. To set up your HSA, you can transfer money from your 401k account or from any other savings account. Then you can write checks on your HSA account or use an HSA debit card to pay for all of your minor healthcare expenses. What's more, you can spend your tax-free HSA money on almost any healthcare products or services, including chiropractic and acupuncture, dental and orthodontics, or hearing and vision care, as well as insurance copays and deductibles. However, you cannot use your health savings account to pay for medically unnecessary or cosmetic procedures, like teeth whitening, facelifts, or hair replacement. But whatever you don't spend remains in your account to pay for future healthcare expenses. So ask yourself this: does it make sense to pay for insurance to cover minor healthcare expenses as well as major healthcare expenses when it adds as much as 40% to the cost of your coverage? Or does it make better sense to pay for your minor healthcare expenses from a tax-free savings account and let the insurance company pay only for your major healthcare expenses, especially if it will reduce the cost of your insurance and give you more control over your own healthcare?